Nagkikita na nira ako. Diri pa. Kita na ako nira.
Yes, kita na tayo.
Mm-hmm. Hello, good afternoon. Can you hear me?
Yes, Doc.
Yes, po, Doc.
Okay, we'll just wait for mga 5 minutes para tanan ka mo makasulod, ha? Okay, shall we start now? Hello? Okay. So this was the last slide that I have shown you last time. The cross-section of the ovary, where you will find the different development phases, no, of the oocyte. Okay, so you have, and the follicle rather. So you have follicular development at the cortex of the ovary. Okay, yung cortex, yung just immediately below the capsule of the ovary. Okay, so you have development of the oocyte and follicles there, the different levels, no? Until in a 28-day cycle, because we consider the cycle of a woman to be 28 days normally, okay? Pero yung iba sa inyo, I know that you have 36 days, you have 34 days, it depends lang sa hormonal level. So in a woman with a 28-day cycle, it is supposedly estimated that at the 14th day, okay, you will have the so-called ovulation, okay? Ovulation is that time where the ovum or the egg is extruded out from the mature Graafian follicle. Do you understand? Miss Amida? Charis, are you there?
Yes, Doc.
Oo. So, kung 28-day cycle, sa day 14, magra-rupture yung follicle in the so-called stigma. May stigma yan, no? It thins out, that area of the follicle will thin out and the egg will be extruded out to be caught by the, which one will catch the egg? Miraflores, Maria Glyceris, are you there?
Yes po, Doc.
Oo. What will catch the egg after it has hatched or it has ovulated?
Wait lang po, Doc, ha?
What do you think? Kasi, kaya nga nabubuntis siya kasi na-catch siya ng one part of your reproductive system and then ma-fertilize siya ng kung may sexual contact during that day, nakakatch siya or ma-fertilize ng sperm. So it will be caught by the fallopian tube, and that part of the fallopian tube is what we call the fimbria, fimbriated end. Okay? Teka, show lang natin sandali, ha? So anyway, it will be caught by the fimbria, and the fimbria, in the fimbria rather, the egg will travel down to its, what part of the fallopian tube? Ampulla, okay? Kasi there are 4 parts of the fallopian tube. You have the isthmus, you have the interstitial part, and then you have the fimbria, and the one that is widest is called your ampulla, ampullary end, okay, or ampullary part of the fallopian tube. Regularly, the site where there is rendezvous of your egg and the sperm is the ampulla of the fallopian tube, okay? Where there is, it is the widest portion of the fallopian tube, okay? So, doon sila nagmi-meet ng sperm at saka egg, okay? And then after 6 to 7 days, or let's say 5 to 6 days or 7 days, that fertilized ovum will have to reach the inside of the uterus for implantation. It will really implant no matter what, kahit mag-pandemic o wala. That egg that is fertilized by the sperm will travel to the uterus and it will implant. So magkakaroon ng presentation and so forth. Okay? Do you understand? Huh? So this diagram or this drawing would just show you that there are phases of the follicular growth. From day 1 to day 14, and day 14, nagmamature siya. Okay? And it will rupture to release the egg. And that egg is caught, it will be, the fallopian tube will catch it through the fimbrial end. And the next part of the fallopian tube is what we call the ampulla or ampullary portion. And it is there nga the champion sperm will fertilize it kung mayroon sexual contact that day. Okay? So, tsamba-tsamba talaga yan. On what day will the ovulation take place? So, we advise our patients, those who are rearing to get pregnant, yung mga babae, and then we advise them to have the sexual contact that day. And we have a test for that. Anong test kaya yan? Miss Pagay, Maria Kain ni Pagay. Are you there?
Yes, Doc.
Anong test? Yeah. Anong test ang ginagawa kaya ng katulad ko ng obstetrician na to measure whether that woman is or will have an ovulation within 24 to 36 hours? What do you think? Ano ka ba? Nurse? Medtech? Miss?
Medtech, Doc.
Medtech. Okay, good. Medtech. Anong test yung ginagamit namin? We send the patient to have that test if we want to know whether she is ovulating or not. It is called the LH test. LH. Luteinizing hormone. Yeah, para siyang pregnancy test na lalagyan ng ihi and then you will wait for a while, mga ilang minutes, and that it will have a double line. Kung double line siya, positive yung test, which means that the lady or that woman will have ovulation or is having the ovulation now or within 24 to 36 hours. So sasabihin namin, okay, umuwi ka na, or kung nandiyan yung mister niya, okay, ano na kayo, check-in sa hotel and you do your thing now. Kasi para siya magbuntis. Okay? So it is the ovulatory test, LH test. That means na nagra-rupture na yung follicle niya, giving way to the egg para ma-extruded out and the sperm will meet the egg para ma-fertilize siya. Okay? And kung hindi naman ma-fertilize, yung, rather, after the ovulation, what happens to the follicle? Di ba yan, mga follicles yan eh. Nag-mature siya. Pag lumabas yung egg, what happens to the follicle? The ruptured follicle will become a corpus luteum. Corpus luteum, okay? And it will release a hormone. Okay, now, in this drawing, you will note that there is development, okay, magtitikadako on follicle, and you have several layers of your follicles or follicular layers. This follicle or granulosa cells will release a hormone. What hormone is released during the first phase of the cycle, during the first, let's say, 13 days?
Progesterone.
Yeah, who said estrogen? Who said estrogen? Miss? Miss Makamay, okay. Welcome again, Miss Makamay. I met you yesterday. Yes, it is estrogen. Estrogen is released by the follicular cells during the first part of the cycle. After the egg is released, the follicle is converted to a corpus luteum, and the corpus luteum will now release another type or another hormone, which is now the progesterone. Kaya alam natin, again, with the results of tests, laboratory tests, whether a woman is or has undergone ovulation, because she will have high levels of progesterone. Okay? Yung hindi nag-ovulate, puro lang yan estrogen, yung ialawas. The blood will only produce estrogen lang, wala siyang progesterone. That is why women who do not ovulate or has not gone so much ovulation, wala siyang progesterone sa blood niya. And estrogen has so many ill effects in the body of a woman. Ano mga ill effects? Now, you will become doctors, you should know the effects of estrogen in the body. Ano, very detrimental kasi ang estrogen. We call it unopposed estrogen. So, kailangan talaga mag-ovulate para may progesterone. But for women with high levels of estrogen, it will cause some cancers, tumors in the body. Kaya nagkakaroon ka ng breast cancer, okay? And you have uterine cancer, endometrial cancer, or endometrial tumors because of high levels of estrogen. Okay? So ito talaga kontra ito ng mga obstetricians. Ang so much estrogens without progesterone. Okay? Ano, hindi na naman namo ba? Excuse me ha. Inin. Sorry ha, may error, technical error here. Okay, so that's it. We are now into the process of oogenesis. Oogenesis occurs in female even at the start of, even before birth. Nasa loob pa lang siya ng mother's womb. A female offspring will already start oogenesis. Okay. At this time, the ovary contains primordial germ cells called oogonia, which are diploid. So remember, oogonia, diploid siya, meaning they have 23 pairs of chromosomes. So the fetus, the female fetus has diploid cells called the oogonia in her ovaries. And during the fetal period, the oogonia starts the process of meiosis, but they are stopped at prophase 1. At this point, the cells are called primary oocytes. Okay, from oogonia, it becomes a primary oocyte. And it is said that the ovary of a female child is estimated to contain about 2 million primordial follicles at birth. Okay? So, habang 5 to 7 months pa lang siya inside the mother's womb, she has about 7 million of the oogonia. Okay? Primordial germ cells. Pag pinanganak siya, 2 million na lang. Okay? And at puberty, she has only about 400,000. Okay? And 20 follicles or eggs is ovulated each month after siya nag-menstruate. Okay? Every month na nag-menstruate siya, she will lose 40 of these follicles. So I said before, di ba? A woman will be losing eggs during her entire life until she becomes menopausic. So yung age ng ano talaga maging maganda yung mga offspring nyo, ladies, will be at that time yung mga 20 plus pa lang. Pag 34 ka na, dapat magmadali ka na. Okay? Kasi ang naiiwan na lang ng mga eggs ay hindi na magaganda. Okay? So, this is just an advice. Ayaw lang pagtuod kaya may masinat yung nanay. Okay, during childhood ovaries, now the ovaries are inactive and atresia will occur. By the time she reaches puberty, only about 400,000 primordial follicles remain. And at puberty, these are the hormones that will have an interplay. Your gonadotropin releasing hormones, the FSH or follicle stimulating hormone, and the luteinizing hormone, which I introduced to you kanina, no? And which will herald the ovulation that will occur during the mid-cycle. The levels of your follicle-stimulating hormone and your LH will vary in a cyclical pattern, which will produce the monthly ovarian cycle. Okay? So this is why the ovarian cycle, sa ovary ito ha, you have phases of the follicular cycle, okay? The first phase, meaning in the first 13 days, is called the follicular phase. Day 14 is ovulation. And the last phase, day 15 to day 28, is the luteal phase because you have the corpus luteum, di ba? Follicular phase, hinumduma ini, the cycle in the ovary. In the follicular phase, you have there the effects of your FSH, follicle stimulating hormone, FSH. You have now the enlargement of the follicle, di ba? Several layers na siya ng follicle cells until such time na naging day 14. Pag day 14, you will predict that there's ovulation. And after that, kasi na-extrude na yung egg, the follicle will become a corpus luteum. That is why it is called the luteal phase, okay? After ovulation. You have to remember that because we will relate this to the uterus later, okay? Yan. The three phases of the ovarian cycle is the follicular phase on days 1 to 13. And you have ovulation on the 14th day in a 28-day cycle, and it's defined the release of the secondary oocyte from the vesicular follicle. And the luteal phase on day 15 to 28 in a normal 28-day cycle. Okay, so as I've said, sa follicular phase, nag-enlarge pa lang yung follicle, and you have several layers of follicular cells. The hormone that's released is your estrogen. Then ovulation comes in at day 14. After that, you will have a luteal phase occurring on day 15 to 28. And there's now another hormone, which is called your progesterone. Okay, it secretes progesterone, estrogen, that supposed to build up the uterine cycle, no, but not so much of estrogen, but progesterone. Lifespan is about 10 to 13 days, and the secondary oocyte is fertilized. So from day 1 to 13, no? And after that, pag hindi na siya na-fertilize, the corpus luteum will become the corpus albicans. Okay. Di ba I said there are two hormones that are produced. The first phase is estrogen. The second, after ovulation, is the progesterone. What happens if towards the end of the cycle, so day 27, 28, or 29? Genre D, what happens to the hormones? Genre?
Hello.
Yes, what happens to the hormones? Kasi di ba, we have a 28-day cycle. Towards a 28-day cycle, what happens to that hormones?
They decline.
Yes, you will have decrease or decline of the hormone. Oh, and this will now, because of the decrease in that hormones, labi na kung there's no fertilization that occurs in the parlance of the common tao, nagtutuok it matres, okay? So ano ba kung nagtutuok it matres, what happens? Unay. Monique. Miss Unay? Are you there?
Hello, Doc.
Yeah, oo. Pag
Sorry, Doc,
nag-decrease na.
nakakautod-utod.
Nakatuutod ka? Okay.
Hindi ka nakakaintindi, Doc, kanina pa.
Hindi ka nakakaintindi. Oh. Ano to?
Connection nga din, Doc.
Hain ka, where are you?
Di ako, Doc, may BNG, pero mahinay kasi connection nga dit akong lugar.
Okay, I think the IT Miss Shasha has already given you may nakamukuan. A copy of this PowerPoint. May kopya ka mo? Each one of you?
Dok, nag-utod-utod ka po liwat.
Oh, nag-uutod-utod ha. Ano kaya? This is not my It's not, it's not, it is beyond me. Paano kaya yan? Can you read? Okay. Karado.
Depende lada dukha ko ng lugar.
Okay, you just read through my PowerPoint. Okay, I will not ask you anymore. Okay, so what happens is that after this, let's say, let's say, waray ovulation. There was ovulation, but it was not fertilized. What happens that the hormone will decrease, okay? And with the decrease of that hormones, it will send a feedback mechanism. And what happens, magtutok it matters in the so-called menstrual cycle, menstruation, okay? So a woman will now menstruate because wala naman niya estrogen, wala na progesterone down. And you will have sloughing off of the denudement of the lining epithelium of the uterus in the form of menstruation. Okay, so the menstrual blood is composed of debris from the the uterine lining, and you have a lot of WBCs of white blood cells there, and of course blood cells. Okay. Now a woman will only have a certain number of eggs in her end. At the age of about 50 to 51, she will no longer have eggs in her or follicles. And this is a time that they will have a decrease, sudden decrease of estrogen. Di ba nag-produce ng estrogen yung follicular cells. Pag wala na siyang follicular cells, wala nang follicles wala nang follicles. So the woman will have a decrease in the estrogen. And this is now your menopause, time when a woman is mga 8 to 10 years before a woman has menopause, mga 42, ganun, no? She will have the so-called perimenopause. The estrogen will begin to drop and woman may experience irregular periods and may even skip periods with very light menstruation. Perimenopause yan. Pero pagka 50 or 51, talaga magme-menopause na siya, no? Woman has stopped having monthly menstrual cycles for 1 year and is not pregnant, she's said to be menopausal. Now, in the obstetrician's book, no, it says 51 years old. But in this slide, it is 45 to 55. Some women really menstruate up to the age of 55. But it says in the obstetrician's book, it is at age 51, okay? Follicles stop maturing and significant amounts of estrogen and progesterone are no longer secreted from the ovaries, no? So the woman's endometrial lining does not grow, it is thinned out, and she will no longer has a menstrual period, okay? So that was insofar as oogenesis is concerned. Now we will have spermatogenesis. Ano naman ang diferensyahan spermatogenesis from oogenesis? Now the spermatogenesis, of course, it occurs in the males and maas konta ako, pare man ka ma-open nga connection. Anyway, I'll try. Sorry. Spermatogenesis, Mr. T. Nile Ralph. Mr. T, are you there?
Yes, no.
Oo. Saan ba nangyayari yung spermatogenesis? Where does it occur?
In the testes.
Yeah, of course, in the testes, but it is in the what part of the testes?
Seminiferous tubules.
Seminiferous, yes. The parent or stem cells that produce sperm cells are called spermatogonia. And spermatogonia are diploid cells that reside in the testes. So again, kanina we said oogonia are diploid. So spermatogonia are diploid. Kaya wala pa man hiya mag-meiosis, okay? That reside in testes, in the seminiferous tubules. Each one of the spermatogonia divides by mitosis to make an exact copy of itself called the primary spermatocyte. Then again, these primary spermatocytes undergo meiosis and produce haploid cells called spermatids. Okay. Now remember about spermatids, okay, because you will have a different shape of spermatids. Hindi ito shape ng spermatozoa, ha? So in this cycle, no, the spermatids contain 23 chromosomes, but they still must undergo further changes to form a sperm cell. So meron talagang process by which the spermatid will be converted to spermatozoa or spermatozoon. Kasi di ba, in the seminiferous tubules, the spermatids are rounded thing, ha? Hindi siya yung sperm na mahaba, with a tail, with a head, like that. So, magkakaroon muna ng process. This is called the Spermiogenesis. The spermatids lose much of their cytoplasm and it grows a long tail and it has a neck, okay? And a flagellum. The tail is called a flagellum. Okay, that's why it is a specialization. For, at least, di ba I said, it has a purpose. It is for propulsion. Okay, so magpropel yung what is the sperm into the inside of the uterus. Di ba? Where are the sperms in the normal sexual, activity? Where will the sperm be deposited? In the vagina, and it will, yes, and it will swim, okay, forward swimming. Because of the flagella or flagellum in the sperm, it will, it will travel up into the cervix, into the inside of the uterus, to the fallopian tube. Di ba sabi ko, yung rendezvous ng egg at saka ng sperm ay nasa ampulla of the fallopian tube. So you know this champion sperm, kasi maraming sperm yan, pero isa lang, the champion, will be the one to penetrate through the zona pellucida of the egg. Pag na-penetrate yung zona pellucida of that egg, then it will render the whole egg impermeable to other sperms. So isa lang talaga, yung champion lang ang makaka-penetrate, kasi pag naka-penetrate siya sa zona pellucida of that egg, magic. Ginkuha na niya, parang nasirahan tanan. Nobody will be able, or no sperm will be able to enter siya lang. Okay? That's why we call it the champion sperm. Okay? So, yung sperms, of course, haploid siya because it has undergone the second meiotic division. No? The newly formed sperm cells are haploid cells that exhibit a distinctive head, a midpiece, and a tail. Okay? So again, from the spermatogonia, a single spermatocyte, it will produce 4 new sperms from that single spermatocyte. All sperms have 22 autosomes, and among ito nga upat nga nahimod, 4 sperms. 2 will carry an X chromosome, and the other 2 will carry a Y chromosome. So I asked you last time, what is what are the chances? What is a chance of having a boy or a girl? It is a 50-50 chance because there are 4 produced by the spermatogenesis. Dalawa yung X carrying and dalawa yung Y carrying chromosome. If it is an X carrying sperm that will be able to fertilize, and it's a baby girl. Pero Y carrying sperm nga ni, you will have a baby boy. So this is just a diagram of how you will have your sperm, mature sperm. Okay, from the germinal or diploid number of the your spermatid, no? You have your secondary spermatocytes, which is After meiosis, you will have haploid na. Rather, the primary spermatocyte, no? Then it becomes a secondary spermatocyte. Then it becomes a spermatid. After meiosis 2, the spermatid will now be haploid. Pero look at the shape of the cell. Spherical or rounded pa yung spermatid. Okay? So spermatid meaning di pa siya makaka-fertilize because of that shape. Now, di rin man kamo mga atheists, there's really a God. Because with this process, you know, the spermatid is converted by means of your spermiogenesis into a spermatozoa, where you will have a head, you will have a neck, and you will have a tail. And may dahiya characteristic of moving or propulsion to reach the ampulla of the fallopian tube. And the sperm has a head. And that head has an acrosomal cup where it contains a hyaluronidase enzyme. Pag penetrate niya, it will it has some enzymes that will lyse and make the zona pellucida impermeable to other sperms once it has penetrated through. So this is now the process of spermiogenesis. Okay? So ano yung process of spermiogenesis? It is the conversion of your spermatid. Dagami, Karil. Are you there? Do you have a good connection? Karil, Dagami?
Hello, ma'am. Hello.
Yeah. Okay, Karil. You have there, do you see the drawing there of spermiogenesis? You have an acrosome, you have what's this, the spermatid, which is rounded, and it is converted to the adult spermatozoa. Okay? So from a rounded, nagiging elongated siya. Okay? So from the round thing, it will diminish its or decrease its cytoplasm. Okay? And it acquires a tail, a neck, and the head. Okay? So, talagang ito, you will have, the sperm has to have this shape. Okay? And, you know, sometimes we subject a man, the husband, a woman that does not get pregnant, let's say mga sobra na 1 year. They got married for 1 year, and still wala pa silang anak. So, we subject the man to have a sperm analysis, or we call this sperm analysis, or the seminal fluid analysis. Okay, and for the medtech, they know this, how to look for the normal shape cells or sperms. So, kailangan hindi siya double head or double tail or bifid tail. Okay? So, talagang regular yung shape niya. Elongated. There's the number of microns there. And hindi siya big head. Walang big head. Ha? Hindi makaka-penetrate yung big head. Dapat talagang matulis siya. Okay? And it has to have the acrosome. The acrosome will contain the enzymes that is necessary for fertilization. Okay? So yan, from a rounded thing, it becomes elongated. Kasi nag-decrease siya ng cytoplasm. Okay? Diba? Tignan mo. Nagde-decrease yung cytoplasm. Now, I remember when I was still a student, in OB, you know, this is an embryo class, but we took up the anatomy of the sperm when I was in embryology. So dapat alam nyo ito rin, the shape of the sperm. because we were asked to draw. At that time, may na pa kami mga drawing, ha? We were asked to draw the sperm from memory, huh? Where the neck is, the head has an acrosome. It has a neck and a tail. Okay. So dapat the sperm will be able to penetrate through the zona pellucida of the ovum. Okay. So it's just a summary of spermatogenesis and oogenesis. Okay. The spermatogonium as well as the oogonium will have diploid number. Once it has undergone meiosis, it will have half the number already and becomes haploid. So the spermatids as well as the secondary oocyte will have haploid the number. In the woman or in the girl, the meiosis will stop until such time that it is ovulated. Okay, and then it will continue again, and meiotic 2 will only complete at the time it is fertilized. Okay, so you will have 2 meiosis, okay, meiosis 1 and meiosis 2. So that was the last slide, because next time we'll take up fertilization. Okay. Okay, may babalik lang akong slide. Okay. Now, the ovary will have a size that is normal. Okay? Usually, the size of the ovary, ano lang siya, dapat 1. Can you still hear me? Can you still hear me? Hello?
Yes, Doc.
Doc.
The ovary will only have a size of 1 to 2 centimeters, 1.5 thick, okay? And the width is about 1.5, thickness also 1.5, and up to 2 centimeters regular size. Okay. And then, katawagon. Joyce, are you there?
So,
Oo. Bakit kailangan natin malaman kung anong size ng ovary?
to differentiate the normal and abnormal.
Yeah, correct. You have a point there. Correct.
Yes.
Kasi, as an obstetrician, we will know na enlarged siya o hindi. We have a cut-off, which is 6 centimeters, okay? Pag nag-6 centimeters ng ovary, then we say that is pathologic. Hindi na siya normal. Kaya, mahabla kami, no? We can be sued if we take out an ovary which is less than 6 centimeters, unless it is bleeding or may mga severe na disease in that ovary. Huh? But normally, we don't take out any of the ovaries kung hindi siya enlarged up to a minimum 6 cm. 6 cm and above, we can remove kasi pathologic siya. So, dapat alam mo talaga ang size ng each of the organs of your body. Ha? Hindi lang ovary. Lahat ng organs, alam mo dapat which is normal or not. Okay? And also, Miss Viernes, Chelsea, have you heard about abnormal menstruation because of the so-called PCOS, polycystic ovarian? Miss Viernes, nandyan ka ba?
Yes, Doc.
Yeah, have you read or have you heard about the so-called polycystic ovarian disease?
Yes, Doc.
Oo, yung
Okay.
the ladies who have PCOS, a polycystic ovarian disease, polycystic ovarian syndrome, will have irregular menstruation. And sometimes they don't have menstruation for 3 months, pero wala naman daw siyang ginawa. Wala naman daw siyang boyfriend. And then when we have the ultrasound, makikita doon na there are certain cystic follicles lang at the periphery of the ovary. So ganyan din yung itsura sa ultrasound, but the follicles do not grow. They're just cystic there and does not grow into mature Graafian follicle. They're a small rounded thing at the cortex of the ovaries, and this is called polycystic ovarian disease. And of course, knowing the hormones, hindi completing hormones niya. She does not have the estrogen and the progesterone that is needed to complete the cycle. So, syempre, wala siyang cyclic menstruation because wala siyang progesterone. Konti lang yung estrogen niya. And so, you will have really incomplete cycle. And the woman might have no menstruation. So, this is called the polycystic ovarian disease. And it will explain why a girl or a woman with abnormal cycle from the polycystic ovarian disease. Hindi siya wala siyang maturity, no mature follicles. Only small non-developed follicles are inside. Hindi siya capable of having normal pregnancy or even fertilization for that matter. And we'll usually get these patients at the clinic na hindi nagbubuntis na women. So there is now a new drug that we have to give to that patient, and of course some other drugs that will have or other medicines that will help her ovulate, and of course a successful fertilization. And usually, no, pagka we have patients with fertility problems, we usually start with the males. Interview namin talaga kung umiinom ba siya, naninigarilyo, because it will have an effect on the production of the sperm in the males. Yung iba naman, there's a disease in the childhood. Miss Ibowa, are you there? Miss Ibowa? Ibowa ba ka pronouncing it? Y-B-O-A? Ibowa or what? Elisha? O Elise? Wala? Or Mineta? Ada ka? Oo. How do you pronounce your family name? How do you pronounce your family name? Ibowa?
Oh, Doc, this is Donceras po. I have a question, Doc.
Anong question mo? Yes.
Doc, if example na naging pregnant na ang girl, pwede pa ba yung ma-diagnose after pregnancy PCOS?
Yes. Pwede pa. I have several patients na usually nagbuntis na siya. Pero several years pa. After several years, hindi siya nagbubuntis ulit. So, maybe she's having PCOS, polycystic ovarian disease now. Pwede yan.
Okay. Thank you, Doc.
Okay. Sino pa may problema?
Actually, Doc, I have a question.
Yes, who is this?
Queenie from Ador po.
Okay. What is the
Queenie
question?
from Ador, Doc.
Okay, Queenie, yes.
I'd just like to know about metformin. Metformin po. How does it work with patients with
Actually,
PCOS?
no, metformin, di ba this
Because I was personally diagnosed with PCOS and I'm taking metformin every day. I'd just like to know how it works.
Kasi yung metformin, ano yan, anti-diabetic drug, and it helps to thin out the cortex, okay? The cortex of that ovary, kasi it has been found out na yung cortex sa PCOS, it is thick, mas thick siya. So that's why di rin nakakagawas ang ovum or the egg. So it helps also in the normalizing of the hormones in a woman. That's why, actually, this is the wonder drug that I was talking about. With PCOS, polycystic ovarian disease, now we give metformin to, just to revert back the cycle of the 28-day cycle. And then we give the woman the fertility pill, the ovulation pill. Sometimes kasi hindi talaga siya nag-ovulate. So we help her ovulate with another medicine. Okay? So with the metformin plus the fertility pill, then swap. The woman will ovulate. So you will be an obstetrician? Queenie ba yun? Will you want to be an obstetrician? Pag-aralan mo na to. Those who want to be an obstetrician, you study well this diagram and this one, embryology, because this will really be your, your base when you go to obstetrics. Dapat alam nyo to from heart. The menopause, what's this? Sorry. The monthly cycle, menopausal cycle na hindi, menstrual cycle rather. So you have to study this, ha? The hormones, tatanong talaga yan sa revalida before you graduate in medicine. Okay? So, until here na lang muna, we'll have fertilization next time. Okay? Okay, bye. See you next
Thank you,
time.
Doc.
Thank you, 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 Doc.
Okay.
Thank you, Doc.
Nabaro ka mo?
Thank you, Doc.
Yes, Doc.
Okay, sige, bye.
The question.
Yeah, paano pang question? Okay, what is the question?
The question. I just want to know. How many months does it usually take to have the hormonal correction for PCOS?
For PCOS, usually we give 1 month anay nga metformin, and then sometimes on the 3rd month, mga 3 months. Mga 3 months siya. Na may able na siya maging ovulatory.
Okay, Doc. Sige po.
Doc, may
Noted. Thank
question
you.
ako.
Sige, yes. Any question pa? Okay.
Doc,
Who's this?
pira ka percent po? Verano po. Pira ka
Okay.
percent po sugalit patient may PCOS, pira ka percent magbuburod pa ya? Depende.
Actually, wala ako ito kay dapat yan talaga exact number yan, ha? I cannot say really, pero most of my patients that I give metformin and fertility pill, they really get pregnant. And it depends on the age, ha? Bisa ka pa tambal ng PCOS 41 na tiya edad, di rin lagi hapon. Di ba I said, ha? You will have only a number of eggs in your body until you are 34. Pag nag-40 ka na, delikado na yan. Ha? We resort to other things. In vitro fertilization na. Ha?
Thank you, Doc.
Okay. Nako, you are interested, ha? So I really want you.
Doc,
Yes. Gusto ko maging OB
question
kayo.
din.
Okay.
Doc, what if Doc kung an girl nagpa-check up na and then nag-take na han medicine, tapos for 3 months ginabot na hiya. And then after that, ma-follow up na unta hiya pero nahadlok kasi pagbalik. What will happen to the girl? Pero waray up until 8 months wala pa rin yung menstruation after ng pills.
After siya gintagan hini? Actually,
Opo.
kasi it's not only the woman or the girl that has the problem. Dapat examine din yung lalaki. Kasi it takes 2 to tango. So, aside from the girl, yung partner will have to be examined also for the characteristic of the sperm. Kasi there are many factors to this. It's not only the ovum. Mayroong factors sa ovaries niya or sa uterus din. Ganon. Kasi timing to, ha? Bisan pa kami nagkakatagin metformin, nagkakatagin fertility pill. If there's no timing, ito pala, may kikwento ako sa inyo. Hindi na matapos-tapos. Yung babae at saka lalaki, interview ko, they only meet 2 2 months in a year. Kasi overseas yung husband, paano siya magbubuntis? And that's really timing. Timing talaga yan. There has to be a sexual contact on day 14 where ovulation will occur. Otherwise, sayang lang. Diba? So there are many factors, multifactorial yan. We analyze things. Okay?
Okay po, Doc. Thank you.
Okay, so that's it. Goodbye, and I'll see you next time.
Thank you, Doc.
Hi, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc. Thank you, Doc.
Okay, Doc.
Okay.